Hello, today I want to talk to you about hammer toes. Now, over the last couple days, we've talked about other deformities of the foot that we want to make sure that you completely understand. So we do have a foot model today. So as we look at the foot model here, this is the normal foot here. And the first day we talked about bunions. And in the case of a bunion, you have the first metatarsal that tilts out and the toe turns in, creating a bump right there at the base of the big toe. That would be a bunion. Taylor's bunion is very similar, except it's the fifth metatarsal tilting out like that, and the toe mildly turning in, which again creates a bump on the outside of the foot that becomes problematic. Today, we're talking about hammer toes. And so with a hammer toe, basically what you're doing is you're starting to get curling of the toes. So you're getting curling of the toes down like that. There are, as you know, in the toes, 4 different joints. The metatarsal phalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. And with the hammer toe, we'll move this toe out of the way here. With the hammer toe, what you'll typically have is several of the joints involved, but there are different types of hammer toes. So if it's just the tip that's turning down at the distal interphalangeal joint, that's called a mallet toe. If it's just the proximal, that is a hammer toe. And then if you get both joints, that would be a claw toe. So mallet toe, hammer toe, claw toe. So you can get any combination of those. All of them are technically called hammer toes. We do it in that way. The other part about this is you get elevation at the metatarsophalangeal joint. So why do hammer toes occur, for one thing? So let's give you kind of a background. You have tendons on the top of the foot, you have tendons on the bottom of the foot, and when either the extensors on the top of the foot or the flexors on the bottom of the foot overpower the other, then you get a hammer toe. If it's the bottom, it'll pull it down. If it's the top, it pulls it up, and then you curl to try to get the toe back down to the ground. So it's an imbalance that's actually causing the problem. That being said, it's also genetic. So if your parents have this problem, there's a possibility that you too could have this problem. Are there things that make it worse? Well, yes. Certain types of activities, certain types of things can actually make it worse. The best example, say, is point shoes can cause worsening of a problem with hammer toes. So how's it diagnosed? Number 1 is symptoms. If you can see it where it's starting to curl, that is proof that you have a hammer toe. You can do x-rays. You can look for any arthritis or narrowing the joint. You can actually look for dislocation of those joints that sometimes can occur with hammer toes on x-ray. But really it's the symptoms of how it presents. Do hammer toes have to be treated? Just like with bunions and Taylor's bunions, I only recommend treating hammer toes if they're symptomatic, if they're causing pain and causing limitation in your life. They're keeping you from being able to do the things you would normally do. That being said, there are things you can do to prevent progression. There are things you can do to reduce the prominence, especially when it's starting to rub on the top of the shoes. And there are things that you can do to fix it surgically. So to reduce progression, there are types of splints. One's called a button splint that we've talked about with the predislocation syndrome, where it pulls the toe down, or you tape the toe down to help with the problem. What that's doing is preventing the overpowering of the extensor or flexor tendons, kind of putting it back in place and not allowing it to be overpowered. The advantage of this is it reduces symptoms, it reduces rubbing on shoes, it reduces callus formation. Disadvantage is, of course, discomfort. Sometimes people don't tolerate the splints, they just are uncomfortable. The other disadvantage, of course, is that it doesn't fix the problem. You take the splint off, the toe goes back to where it was. There are also certain types of sleeves and padding and stuff like that you can do to reduce pressure. So if your toes are curled up and you're rubbing on the top of the shoe, there are gel pads that can be put over that toe, sleeves or pads or whatever, that will actually reduce the rubbing, reduce the symptoms, and prevent surgery or postpone surgery until a later date. The surgical correction of this is you actually go in and realign the toe. There are multiple ways that can be done, whether it's going in and removing the joint and so that you can actually straighten the toe back out. It reduces the overstretch of one of the tendons. It basically reduces the overpowering, I guess is the better way to say it, of one of the tendons over the other. You can also fuse toes. Typically when it's the second toe, the toe right next to the big toe, we will fuse it, for example, to reduce it from coming back. Because if all we do is remove the joint, it improves for a short time and then it progresses again over time. So surgical correction is a possibility. I usually recommend it only if you still have symptoms or if you're having symptoms that are interfering with life. Otherwise, padding, reducing stress, or getting into some kind of a specialized orthotic or insert to change the way you walk just enough to reduce the progression of that deformity. This is Dr. Brandt Gibson. This is your podiatry tip day number 20, hammer toes. And tomorrow we'll start talking about the ankle sprains and ankle instabilities and so forth over the next couple days. This is